Hello, my name is Mike. I'll be doing your physical examination today. What's your name?
My name's Carrie.
Hi, Carrie. Nice to meet you. I'll be washing my hands here before we get started.
All right.
Could you tell me your full name, date, and birthday?
Sure. Carrie Columbus. My birthday is June 14th, 1974. And today is August 30th, 2017.
All right. So what I was doing was examining Carrie's orientation. She has good orientation. She has a appropriate mood and affect. She is alert and oriented ×3. Next, I'll be looking at your skin here. Not only is it's smooth, its texture is smooth, it's warm and dry. The color is appropriate for an ethnicity. I did notice about a 2 millimeter macule on the posterior mid-shaft forearm without induration. There's no redness, no swelling, no drainage, no signs of infection. It seems to be a normal macule or normal freckle, as some people will call it. I'll be looking at your, and the skin felt warm and dry, I said that already. Okay, I'm going to feel your scalp here. There's no bumps, there's no lumps, everything feels normal, there's no signs of infection, there's no drainage, I don't see any open scars, any open wounds, there's no scaliness. The hair looks, it's well groomed, it's blonde, and it's normal texture, it's not coarse. Your face, I'm gonna see. Can you feel me on this side?
Mm-hmm.
I'm checking her sensation on both sides of her face. Can you feel me on this side?
Mm-hmm.
Okay, I'm gonna have you smile. I'm gonna have you blow your cheeks out. I'm gonna have you. I'm gonna feel your temporomandibular joint. I'm gonna have you open up your mouth. I'm gonna have you go left and right with your jaw. I'm gonna have you push it forward or jet it forward. And what I'm noting, there's no bony crepitus, no abnormal movements over the bones, no lumps or clicks or bumps. Everything felt normal at the joint. I'm going to have you grit your teeth down to feel and go ahead and relax. The temporal masseter muscle feels normal strength. I'm going to have you push your chin against my face, against my hand, and against my hand again. I'm doing the sternocleidomastoid mastoid muscle, felt normal strength. And then the shoulder shrug resistance is normal. I'm looking at your throat. It's symmetrical. Your neck is symmetrical. Your trachea midline. There's no torsion. There's no abnormality. Your trachea looks normal. I'm gonna feel your lymph nodes. I'm gonna do your preauricular, postauricular, your occipital, your masseter. No. Okay. It's your tonsillar, your submandibular, your submental, your superficial cervical, your posterior cervical, your deep cervical, your supraclavicular, and your supraclavicular. Right underneath that, your infraclavicular on both sides. I don't feel any abnormalities, any swelling. I didn't elicit any pain or feel any lumps or lesions or masses over any of the areas that I've palpated over her lymph nodes. Going to look at your eyes, do a visual test here. I'm going to bring my fingers in, tell me when you can see them.
Mm-hmm.
Okay, and do it again. Visual confrontation test, you can see them. I'm going to check she's pearl, pupils equal reaction to light. And they're 3 millimeters and equal reaction to light. And follow my finger. All right. They are perla. I noticed that the subconjunctiva is pink and normal. There's no drainage, there's no styes, there's no signs of infection. Her sclera is white, also with no signs of infection, and there's no redness. The I'm checking out the red light reflection is normal on both eyes. Red light reflection is normal on both eyes. Looking at your ears, your auricles are fine. Your ears are normal. There's no tenderness. The pen is fine. The superior auricles are in line with the canthus of the eyes. This all appears normal. Your nose, the bridge of the nose, the tip of the nose, the dorsum of the nose, all looks normal. Can you blow out on your side? There's patency on both sides. I'm going to be looking at the mucosa of the nose. Looks moist and normal color. It's light pink. There's no drainage. When you look in your mouth here, I'm just going to look at your teeth, normal dentation, your gums look fine, your buccal mucosa looks fine on both sides. Stick your tongue out and say, ah. I see 2 tonsils that are normal, they're not red, they're normal size, there's no exudate, there's no drainage, you have a normal uvula that is not swollen. The tongue papilla is normal. Your tongue strength, can you move your tongue left to right? It looks normal to me. Your soft palate is normal, is a normal color. Your hard palate looks normal color. There's no redness, there's no white patches, there's no abnormalities noted. Nose. And your throat, and I'm going to have you, and I did your sensation, so I'm going to listen to your lungs, your chest, it looks like 2 to 1, which is normal, no barrel chesting, no signs of COPD. I'm going to put my hand on your chest here and have you go 99. I'm testing for tactile fremitus, or fremitus. Again. 99. Again.
99.
Again.
99.
Again. 99.
99.
Again.
99.
Again.
99.
Again.
99.
And I'm feeling, I'm palpating. There's no masses. I'm not eliciting any pain. I didn't note any fremitus, which would have indicated a pneumonia. I'm going to listen to your lungs. So I'm going to have you take a deep breath. And again. Again. I'm listening to all lung fields, pointing out any adventitious lung sounds if I hear any. And lift your arm up again. And one more time. Okay, on this side. Again. No adventitious lung sounds on the front. I'm going to palpate your back lung area. I don't feel any masses. I'm not eliciting any pain. I don't feel any bony crepitus. The bony structures feel fine. I'm going to test your costovertebral angle. I'm not getting any pain there. No pain there. I'm going to have you again go 99.
99.
Again, 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
And I don't feel any tactile fremitus on the posterior surfaces. I'm going to listen to your lungs again on the back side. Deep breath, right? Out. Just in and out. In and out. And I'll be noting again for any adventitious lung sounds. No wheezes, no rails, no rhonchi. I don't feel any cough. There's no coarseness. There's no coarseness. One more time. And one more time. That feels fine there. I'm going to percuss. Should feel I'm percussing with hitting my middle finger on top of my middle finger. On over all lung fields. I'm listening for anything dull over bony surfaces. I should feel dull, hear dullness over the lungs. I should not hear any dullness. Like that here. Okay, I don't feel anything there. Or elicit any abnormal sounds through percussion. I'm going to examine your heart now. I'll auscultate your heart. I'm going to do the apical pulse, a point of maximum impulse here. I would listen for an entire minute, but due to time constraints of this class, I will not be listening for an entire minute, but normally in a normal exam, it would be 1 minute. I'll listen over the pulmonary valve. Excuse me, this is the aortic valve. Excuse me, I was wrong. It's the aortic valve. The pulmonary valve. Ebbs point. The tricuspid valve. And the mitral valve. I would be listening, noting any murmurs, gallops. I did not hear any murmurs or gallops or abnormal lungs or abnormal heart sounds. They were S1, S2. I'm going to have you lay down for me. And I examine your abdomen. Okay. The abdomen is flat. Flat. I'm going to listen for any I'm going to listen for 1 minute at each quadrant. What I am noting is any abnormal bowel sounds. Now, the time constraints of this class purposes, I'm not listening for an entire minute. Under a normal exam, I would listen for 1 minute in each quadrant. I'll do light palpation. Don't elicit any pain. I'm going to feel over the umbilicus. I don't feel any umbilical hernia. I'm going to do some deep palpation. I'm going to feel liver, spleen on this side, the kidney, deep here the kidney. I don't feel any masses. Go ahead and set you up here. I'm going to look at skin turgor. Skin turgor is brisk, less than 2 seconds. There's no clubbing of the fingernails. Cap refill is brisk and less than 2 seconds. The skin again looks normal. The lower extremities, the skin looks normal. She has shaved her legs, groomed. I'm going to feel over your bony, your joints and your arms, your bony prominences. I don't feel any abnormalities over the joints. No crepitus noted. I just squeeze and hands for grip strength is normal. I'm feeling over your knees, your calves, your ankles, your feet. Everything feels normal. Your calves, your ankles, your feet. Feeling your hips. Your hips feel fine. Your spine Feels fine. Okay. I'm going to have you, I'm going to look for movement of your head. I'm going to have you move left to the right and roll it down, go front to back. Hyperextension, flexion, hyperflexion is fine. I'm going to go ahead and have you stand up. I'm going to have you raise your hands up, go all the way up to the top, go all the way down to the bottom. I want you to resist against me, push. Okay, bend down. Okay, now pull your arms towards you and away. You got good strength there. I'm going to have you move your hands, abduct, supinate, pronate. Everything's fine. I'm going to have you lift your leg out, your knee up. I'm going to have you adduct. You can hold on to something. Adduct, abduct, let down, lift your knee up, abduct, and down. With your foot, I'm going to have you move your internal rotation, external rotation, plantar flexion, dorsal flexion of the foot. Same thing with the other foot. Internal rotation, external rotation, plantar flexion, dorsal flexion. With your hip, I'm going to have you do an external rotation and an internal rotation. It's fine. External rotation, internal rotation is fine. Okay, I'm going to go ahead and have you sit back down. I'm going to check out your dependent reflexes. Which will be your brachial, and your brachial. Let that relax. That's your tricep. Is that weird? And your tricep. All right. Here in your radial. Again here. It's a hard one to get. Your patellar, your knee. Oops, sorry. Here we go. All right. And then normal reflexes. Get your ankle or your Achilles. And then with the bed out, I would take your plantar. Look for abnormal finding would be your toes fanning out. I would look for the foot to scrunch up. That would be a normal finding in an adult doing the plantar on both sides. And then I have you push against my hand, looking for clonus. I let go. I don't see any clonus. Again, push against my hand. Second, let go. I don't see any clonus. I'm checking out your pulses, your peripheral pulses, which your dorsalis pedis, posterior tibial, your popliteal, your femoral. I'm noting rate and rhythm, normal rate and rhythm. I would call these +2/4 peripheral pulses. But on all my pulses, my radials and my brachials, and my carotids, I don't do them both at the same time. I'll do one and then the other. Everything feels fine. Go ahead and let this down. I'm going to have you close your eyes. Hold your hand out for me. Tell me what shape this is I put in your hand.
A triangle.
Okay. I'm going to draw something in the center of your hand here. Tell me what this is.
A big circle.
Okay. And now I'm going to go ahead and relax. I'm going to point your foot in a direction. You tell me whether your toe is pointing up or down.
Up.
Okay, great. So this concludes my examination. You pass with flying colors.
Yay, thank you.